targeting. So as I just said, if I am working in a tuberculosis ward where I have lots of patients with tuberculosis, I know that tuberculosis is usually the of this list, which means it is a highly resistant organism. So to kill a highly resistant organism, you need to have a high level disinfectant which you have to use. But if I am talking about say enveloped viruses, for example, if I say that there is a spillage of blood somewhere present on a patient's table or say on the floor, then this blood will have most of the time viruses like HIV or hepatitis B or hepatitis C. So because these are envelope viruses, it is very easy to kill them. So if I want to ensure that the virus is present in that blood drop are killed, I don't have to use something which is a high level disinfectant. Because these viruses are very susceptible, very easy to kill, a low level disinfectant will also be can also be used over here. So you have to define your purpose. Why do you want to use a disinfectant? Second, you have to find out which are of microorganisms that I can expect on that particular surface, keeping in mind you will use the disinfectant over there. So whenever you work in a hospital, none of the hospitals or any healthcare center will have only one kind of disinfectant. There will be a variety of disinfectants present within a healthcare setting, depending upon what is the purpose of their use and what are they expecting on their surfaces. So you can have more than 3 or 5 different disinfectants for different purposes in the hospital. So when I have to select a disinfectant for my use in my hospital or in my healthcare setting, I have to keep in mind certain factors, right? So first of all, what type of microorganisms I am expecting in and around my patients, and what will be their load? How many would they be in numbers? Will help me to select my broad spectrum with rapid action. I want a disinfectant which can cover majority of microorganisms and should also have a rapid action, which means it should not take lots of time to kill microorganisms because then it is of no use. How does actually this disinfectant acts on microorganisms is also a factor that will contribute to your selection. What is the amount of organic matter present on the surfaces? So how frequently dusting is happening on these surfaces? How contaminated are my instruments? Will also lead to selection, is also one of the factor which helps to select your disinfectant. Means a disinfectant who is able to act very good even in presence of organic matter is considered to be a good disinfectant, right? Because that will lead to reduce in your cleaning activity. Concentration of disinfectant is very important. Sometimes some dilute to bring them to a certain concentration before you can use, whereas certain disinfectants can directly be used at the concentration at which they are available, right? So that concentration of disinfectant becomes important. Contact time and temperature, for how long do you want to expose your item to that disinfectant is known as contact time. So if I am dipping my surgical instruments in a disinfectant for half an hour, and there is another disinfectant which claims that we will be able to disinfect your instruments within 10 minutes, then the one with 10 minutes is a better disinfectant. Sometimes even temperature of your uh, surfaces as well as the disinfectant will ensure uh, the selection of your disinfectant. Residual activity, there are certain disinfectants who will have a residual activity, which means even after the exposure of your item to that disinfectant is over, the effect of that disinfectant stays on for a longer period of time. A very simple example, suppose if I am wiping my surface on the table surface and I'm trying to remove the dust particles present on these surfaces. If I'm not cleaning, the dust particles are again going to settle after certain hours. When I talk about bacteria, if I'm removing bacteria on a table surface using say XYZ disinfectant, the bacteria are going to settle again on that surfaces after some time. But if the residual effect of even if the bacteria settle on that surface, which has now completely dried out, the bacteria can still be killed by the residual effect of that disinfectant. So any disinfectant which is having a higher residual activity should be used uh, in your daily practices. Interaction with other compounds, very important. Sometimes you have to mix your disinfectant or you have to dilute it with certain things. Sometimes that dilution can be done even with a tap water, or sometimes it might require uh, say sterile distilled water also. So many a times you also have to dip certain things which have been used at places where they would have come in contact with some chemicals. So you have to ensure that when such items are mixed with these disinfectants, they should not cause any reaction. At the same time, the disinfectant should be able to act in a way that those items with reagents, these unknown reagents, they do not interfere in the process of disinfection. Toxicity to environment, definitely, because these are the reagents or chemical reagents which are going to be applied on many surfaces. We have to ensure that these disinfectants, they do not harm these surfaces. For example, if I talk about sodium hypochlorite, it is one of a very commonly used disinfectant, but you cannot use sodium hypochlorite on metals because in the long run your metals will get corroded. So in that case, sodium hypochlorite is completely avoided while you want to disinfect any metal surface. And obviously the last important thing is cost. Everything, if the disinfectant is satisfying, as we see in this list, obviously the cost is going to be very high. So there has to be balance between what you actually need, what is your purpose, and how much you can spend for a disinfectant. So obviously cost is something, but doesn't mean that we have to purchase the cheapest disinfectants available in the market, because there can be, there are so many, the quality of disinfectants is not ideal, and therefore whenever you use them in your setup, it will not give you the desired effect. And what you would notice is that the infections in your patients are usually increasing. So all these factors are supposed to be kept in mind while you are uh, selecting a disinfectant for use in your healthcare setup. How do these disinfectants or antiseptics act? The common ways by which they act are by killing bacteria, by damaging their cell wall, or some of these disinfectants or antiseptics may just coagulate proteins in this bacterial cell, and therefore the bacteria would be killed. Sometimes they would also inhibit enzyme activity or say nucleic acid synthesis, and there can also be oxidative damage that can happen to organisms. So a disinfectant can be a single reagent, or even it can be a combination of different reagents. Each of this reagent will have a different way of killing microorganisms. So you can have more than one ways of killing a bacteria. Similarly, uh, you can have a combination of different reagents making one chemical disinfectant, and each of these reagents will have a different way of killing microorganisms. So these are some basic ways by which the antiseptics or disinfectant would kill your microorganisms. If I have to categorize these disinfectants under various groups, then these are the groups: alcohols, aldehydes, phenolic compounds, quaternary ammonium compounds, halogens, oxidizing agents, salt and heavy metals, surface active agents, and dyes. So these are all the various categories under which disinfectants come. And as I said, in the next or in the subsequent lecture, we will be going into details about each of these categories. We'll also try to give you some examples of disinfectants that are commonly in use and which can be categorized under this particular list, and their advantages as well as disadvantages. So again, if you see in this chart, it's a chart which I have just taken from the net, and you can see there are three categories of disinfectants. disinfection, high level, intermediate, low level, and the next column is supposed to be actually used. Also, there are examples under high level disinfectants like glutaraldehyde, hydrogen peroxide, and their concentrations that they are supposed to be used. The third column basically describes what should be the contact time, for how long your surfaces should be in contact with these disinfectants, advantages and disadvantages of each one of these. So as I said, most of these things will be covered in the subsequent lecture. If you have any queries, and you can definitely ask when you come offline. Now, a very important thing which should help you in selecting a method of sterilization and disinfection is this classification, which is known as Holding classification. This is very important from your exam point of view. This is also very important from um, from a concept point of view when you are working in your own hospital or clinics. Because many a times a question will come to you that what should I do to this particular item? Should I sterilize this item or should I disinfect this item? If I am disinfecting this item, should I disinfect it with a high level disinfectant or a low level disinfectant or whatever it is? So instead of remembering the item and then trying to remember the name or the method of sterilization or disinfection, it is easier to classify them as per their use, right? So all these items, whether they are used or are in the vicinity of the patient, these items can be classified into three different categories. One is critical, semi-critical, and non-critical. So what are these critical items? Critical items are those items which enter tissues and body fluids, which penetrate your skin or which may penetrate your mucous membrane and enter into your sterile tissues or body fluid or body cavities, like surgical instruments, like catheters, like IV lines, right? The needles, the syringes, or even the IV fluids that we are going to give to the patient, or medications. So all these items, they basically either enter into your sterile tissues or they penetrate your skin or mucous membrane. All these items are considered to be critical items. Critical items because not even a single microorganism should be present on their surface. Because if it is present, then it will be carried into your tissues and then it can multiply over there and cause infection. So all these items are supposed to be completely free of microorganisms, which means the best method to make them free of microorganisms is usually sterilization. And again, there are various methods of sterilization which are available, but the most commonly used method is autoclaving. So by autoclaving all these items, you can make them free of microorganisms and then you can use them in patients. Any items that you can see in the market, if you go to a pharmacy store, if you buy a syringe, if you buy a needle, if you buy a catheter, all these items would be sterilized items. They would be completely free of microorganisms. But many a times, autoclave is a method of sterilization by heat, and the temperature usually is more than equal to 121 degrees centigrade. So metal items, if they are to be sterilized, autoclave is a very good way to sterilize them. But they do not, or polyvinyl chloride, they do not withstand such heat. So for example, if I have to use a syringe, then syringe basically cannot withstand heat, and therefore we do not subject it to autoclaving, and therefore we have to have another method of sterilizing them. And most of the time, it's a gaseous method of sterilization, and that gaseous method is by using the gas known as ethylene oxide gas. We can also use other methods of radiation like gamma rays to sterilize these items. So whenever you buy these items from the market, and if you just see the wrapper, they would have mentioned the method of sterilization over there. Most of the time it will be ethylene oxide. They would have mentioned either ETO or EO over there, sterilized by EO. So these are all sterilized items. Many a times you may not be able to sterilize these items by autoclaving or say ETO. And another option that is available is a disinfectant, a high level disinfectant, which can also act as a sterilizing agent, and we call them as chemical sterilant. Glutaraldehyde, hydrogen peroxide, peracetic acid, etc. These are considered to be uh, chemical sterilants, and they are also used for sterilizing these items. A very common example, if you know cardiac catheterization, or if I say somebody is undergoing angiography, then there are some metal guide wires which are being inserted into patients' veins. Now, these guide wires are very costly. So once they are removed from patients' veins after the procedure is over, they are first cleaned and they are dipped into more than 2.5% solution of glutaraldehyde for at least 10 to 12 hours. So by dipping them in glutaraldehyde for 10 to 12 hours, these guide wires, they get sterilized. And once they are removed from this glutaraldehyde, they are washed with sterile water, and then they can again be inserted into a different patient. So the same guide wire can be used again and again instead of purchasing a new guide wire, because a new guide wire per patient is going to be very, very costly. And therefore, these guide wires are actually reused. So these are all critical items and they have to undergo sterilization. If the item can withstand heat, then the best method is autoclave. If the item cannot withstand heat, then we should go either for a gaseous method of sterilization or a radiation method of sterilization, or sometimes chemical sterilants can be used. The second category is known as semi-critical items. Semi-critical items are those items which come in contact with mucous membrane or non-intact skin, but do not enter into the tissues or body fluids. So mucous membrane, if I am putting something in my mouth, then my mouth contains mucous membrane. That item is called semi-critical item. Your endoscopes, the scopes that enter into your gastrointestinal tract to visualize any pathology present over there, they are coming in contact with the mucous membrane only. They are not penetrating mucous membrane. So therefore, any items that are coming in contact with mucous membrane, they are basically considered as semi-critical items. So resuscitation equipments, laryngoscopes, uh, vaginal speculum, thermometers, oral thermometers that are being used, this gastrointestinal or respiratory scopes that are being used, all these items, they are considered to be semi-critical items. Semi-critical items need not be sterilized because the place at which they are entering is already contaminated. So if I am entering something into my gastrointestinal tract, my gastrointestinal tract is studded with microorganisms. So it is not entering into a sterile site, it is entering into a contaminated site. Therefore, you need not sterilize these items, but what you need is, because it is coming in contact at a site where the microbial load is very high, the number of microorganisms are very high, it is important that we remove this high load of microorganisms, and that can be done by using a high level disinfectant like glutaraldehyde or peracetic acid or hydrogen peroxide. So all semi-critical items should be disinfected using high level disinfectant. Last category is called non-critical items. These are the items which come in contact with intact skin, but not the mucous membrane, or which may be present in the vicinity of patients. So if you try to enlist these items, all items such as stethoscope, your BP instrument, the auxiliary thermometers that we use, uh, patient's bed, patient's cot, patient's linen, even I would say patient's table surrounding the monitors on which we see various values of patient's vitals, all these things which are in vicinity of the patient, even your mobile phones, when you are basically in contact with your patient and then touching the patient and touching your mobile phone, all these items are considered to be non-critical items. Non-critical items, they directly do not play a major role in transferring infection from one patient to another, but obviously if the microorganism numbers on these items, they go beyond a certain limit, then they become important source. Whereas there are certain microorganisms that even in small numbers, if present on these surfaces, can be transmitted to another patient and cause infection. So all these non-critical items, they have to be disinfected with a low level disinfectant. Sometimes even detergent and simple detergent and water will act as a low level disinfectant. So if someone is using a bad pan for passing stool in bed, this bad pan is usually first flushed with simple tap water, and then it is washed with detergent and water. So detergent and water will also act as a good disinfectant. But other examples of disinfectants, low level disinfectants, would be your alcohol, your sodium hypochlorite, and so on. So as a medical student, when a second year medical student, when you go and start working in the hospital, you have to ensure, or if you try to look around and see these items and then categorize these items, that yes, this is a stand which is used for hanging the IV fluid bottle, under which category this stand would come, then that stand would come in non critical items. So non critical item के लिए हमको क्या use करना है, कौन सा disinfectant use करना है. This is how you have to remember. So you will get an idea, a rough idea of what is supposed to be used. But for now, very important for you is when you go to the clinics, you have to look into disinfecting your personal items that you are going to use on patients. Very important is your stethoscope. So you have to make a habit of cleaning your stethoscope again and again using 70% alcohol. Right? So जो स्टेरिलियम हम यूज करते हैं अपने हाथ पे, उसी स्टेरिलियम को यूज करके हम अपने स्टेथोस्कोप को भी वाइप कर सकते हैं, so that you do not carry organism from one patient to another. Right? So stethoscopes has to be cleaned as much as possible. Very good if you are able between examining two patients. So the on Spalding classification. This classification, as I said, remember this classification. It's a very easy method to identify a method of sterilization or disinfection, not only from exam point of view, but also when you are practicing in your practicing in future as a doctor. Right, so this is all about today's session. What we have seen today is what is the significance of disinfection, what do we mean by disinfection, what are different definitions that were used in context with sterilization and disinfection. We saw what are different levels of disinfection. We saw how should we select a disinfectant depending upon our use. And then finally, we saw what is Spalding classification. How can we classify various items that we use in healthcare, and how this classification helps us to select the method of sterilization and disinfection. Knowing these things is is not the only thing that we are supposed to do. I think a practical implementation of this knowledge of sterilization and disinfection in our day-to-day practice will definitely ensure that your patients in hospitals will not get infections from you, and it will also ensure your safety. So just keep in mind this particular thing and go through the topic. If you have any doubts, then definitely you can come and meet us when the classes begin offline. Thanks a lot. Have a nice day.